Good afternoon. Welcome to Friday Live with the Boobie Docs. As they will be joining us soon, just bear with us. We are so excited to be able to come on and learn about other physicians, as the Boobie Docs are two best friends that are now in practice together. Hello, how are
Hi,
you?
how are you?
I'm great, thank you. Are you enjoying Florida?
Oh my God, I'm enjoying Florida so much. If you can't tell, I'm sitting out by the lake, which is a real treat for me, coming from New Jersey.
Right, I'm sure. And I'm like, we're in the same kind of similar background, palm trees,
I
just what we need
know.
behind us, right?
It's so crazy that you're in South Florida also. My
I
mom's
know.
on, and I'm at her house, so it's funny. She's in the other room.
Oh, that's so funny.
Hi, Mom.
It's I'm sure my mom and my daughter are gonna pop on too. So,
My kids probably will pop out and watch this as well.
well, I'm
Interrupt.
not surprised. My kids went to my mom for a couple hours because we're having Passover tomorrow night, so they're there helping her like prepare and everything. So I'm like, have fun.
That's so nice.
So, well, thank you so much for coming on today. I'm so glad we were able to connect and,
Thank you.
just continue to educate the community.
Yeah.
Before you came on, I was just telling the ladies, about you and your partner, how you guys are, great friends and you guys have built this amazing program together. And
Thank you.
maybe we're going to start out with just some basic information from both of you, and then we could dive into a little bit of BRCA Strong and talk about how we're going to work together and how we're going to educate.
Sure. So my name is Robin Roth. I'm from South Florida, but I currently live in New Jersey. I'm a breast radiologist. I've been about 7 years out of fellowship, and I am fortunate enough to work with my best friend Adrienne Rosenthal, who's currently in New Jersey working. She's also a breast radiologist. We're both 7 years out, and we started this Instagram, the Boobie Docs, to really talk about breast health in a way that is approachable. We're approaching 40, and all of our friends are starting to ask when should they be getting mammograms, and some of them have been, have BRCA or BRCA positive. So we get lots of questions. So we thought this was a really good way to kind of talk about breast topics in an approachable way. So we make fun TikToks, and we make fun. We invite our genetic counselor friends to work with us. So we're really excited, and we work with amazing organizations like yours. So
It's great when we look at some of these TikTok videos. BRCA Strong's not on TikTok. I just don't have it. And I like watch all you physicians, especially, really capture my attention, especially like educating instead of educating it, like seeing it from like your patient next to you,
mhm.
receiving the results or finding out, they have breast cancer or whether their situation's just genetic testing, but taking it and making it fun because
Yeah.
nobody ever wants to receive a diagnosis. So that was really one of the reasons that caught my attention so much about your page is it's different. It's not where you're going there and you're just seeing information. You're seeing educational information in a fun way.
Right. It's funny. We never did TikTok. Like we didn't know how to do it either. And then we wanted to try to get on it because, we're still silly. Like there's a part of us, it still feels like we're like teenagers. So, we started playing around with it, and it's crazy. You make a post that's really elaborate and has so many recommendations, and you get a few likes here and there, but you post a TikTok and people go crazy. And so, you also have to kind of give people what they want. So we're trying to
Right.
do a mix.
But again, combining the fun with the education totally
Yeah.
takes the ease off for a lot of women.
It's easy though. You should try it. It's fun to play around.
I'm like, that's just another platform for
I know
us.
it
In
is.
between mom life and rock star life and married life, it's like, where do you go? Which angle do you take?
There's so many
So
platforms right now, which is a good and bad thing.
yes. So let's talk about, I'll do a short introduction and then let's definitely talk a little bit more about like the screenings, the aspects, genetic testing, and what's
Mhm.
going on in our community with later diagnoses, the higher mortality rate in African American and Black women.
Mhm.
So first, for those of you that don't know me, I'm Tracy. I'm the founder of BRCA Strong, where we alleviate the emotional and financial burdens of survivors, survivors, and thrivers, regardless of predisposition, to eliminate the feeling of isolation and help you feel whole again. And we do that by funding pre-mastectomy care packages, which include a drain holder with a robe, post-mastectomy pillows, and a post-mastectomy garment. So if you or your family or friend are in need, you can feel free to reach out to us. There is a process that we go through for screening. And we look forward to hearing from you. And if there's anything that you need, you can definitely PM us or DM us any way we can help you.
How do you get your funding for your programs? Is it through donations?
So we get donations.
Mhm.
We also do get a lot of sponsorships, and we're working on grants. We actually just had our first grant approved about 2 weeks ago, and we will be providing free mammograms to women in the city of Coconut Creek.
It's amazing.
So it's on sponsorships and donations and our fundraisers. Right now we have a fundraiser going on. It's not about the breast, it's about the woman. We always talk about breast cancer and losing a breast or going through treatment and having radiation burn, but like we're women as a whole. And I feel
Mhm.
like that's taken away a lot of the focus from what we are. And breast cancer has become like something that's just about the breast. No, we're more than our breast.
Right.
And one thing that we want to bring recognition to is it's about the woman
Mhm.
and who we are as a whole. Partnering with physicians, reminding us of what we have to go through and how to prepare us mentally and just getting your results, I think is so imperative. And I think that it's just been taken away in our community. So we decided to launch this fundraiser this month in May, April, May, and it's
Mhm.
been fantastic. We
Amazing.
have sold 78 shirts. We're super excited and can't wait to hear all the women's stories, about what they're sharing and why they're doing this. Because again, it's just not about bearing, it's about sharing the educational part behind it and the
That's
impact of
so
your
incredible.
story.
So I remember you told me that you were diagnosed with you were found out you're a BRCA2 carrier about 10 years ago, and then you decided to found BRCA Strong. Tell me what
Yeah,
that was like going through it by yourself when it wasn't as many, you know, uh, I don't know what I'm trying to say, things available.
organizations.
Yeah,
Yeah,
organizations available.
So when I first found out I carried the BRCA2 gene mutation, it was only 10 years after, the BRCA gene mutation
Hmm.
was found.
Hmm.
And it just was a mess. Nobody knew what to do with me. Nobody knew where to send me. What I was offered was tamoxifen. And
Hmm.
I'm like, no, I'm not going on tamoxifen. My grandmother, all of her sisters had breast cancer.
Hmm.
Some of them were positive. One was found in her 40s. We lost her. Like, it just wasn't an option for me. And I'm like, there's no support groups out there. And at that time, survivors and survivors were looked at
Hmm.
so different. Like there was no general community where everybody supported one. And I'm like,
Hmm.
what can I do? Before I started my surgical journey at the age of 32, now I'm 38, I said, I'm going to start this small little group
Hmm.
on Facebook. Never thought anything about it. Worked full time, was a full time mom.
Hmm.
My son was 3. And as I was going in for surgery, I'm like, there has to be more women like me. And all of a
Hmm.
sudden it started growing. We're about 3,000 women national now. We screen you to come in, and it was just a safe zone where I could go ask questions.
Hmm.
Some of the questions that I had is like, how do you prepare for this? How do you talk to your kids? I met
Right.
so many women that were going through it. Like I found a book called Proactive Genes just to share with women, to share with their children. No, it's not about going in and having a mastectomy. It's talking about your families. There's different resources out there that I just had to search so hard for. I'm like, this is crazy. I cannot let anybody else do this.
Hmm.
So then from there, I grew to a nonprofit and was like, oh, what do I want to do? Where do I want to go? I know a
Hmm.
lot of people in the medical community and said, I definitely need to just maintain this and keep growing. And I
Hmm.
decided to become a 501c3 about almost 3 years ago.
Amazing.
And now we're national, we fund women. So it's been a great experience. And besides funding women, the education part has not been so not only beneficial for our community, but for myself and for my
Hmm.
family. And like meeting physicians like yourself who
Hmm.
want to come on and educate and, you know, like I said, just talk about topics that aren't really spoken about. And I
Right.
feel it's imperative. Knowledge is power. I feel like
Hmm.
there's a lack of education in breast reconstruction options. So
100%.
now we have on our website that we just relaunched, all your breast reconstruction options that are available from A to Z. You don't have to go anywhere to search for them. You go on BRCASTRONG.org and your options are there. Genetic testing, genetic counseling, where to go, who to go see.
Hmm.
We need these resources. They shouldn't be everywhere.
Yeah. No, it's so important. And, and like you said, at the time you were only offered tamoxifen, and now there's so many different treatment options or ways that you can reduce your risk of developing breast or ovarian cancer, or just trying to find it early, which is, another key. I'll touch a little bit on ways, I'm certainly not a geneticist, but we've spoken with our genetic counselor. I'm a radiologist if you missed the beginning. But in terms of breast cancer screening, we recommend starting breast cancer screening with MRI starting at age 25. And starting at age 30, you add in the mammogram at that point as well. And we typically stagger them every 6 months. You're doing mammography or MRI. So if you're going to develop breast cancer, we try to catch it early. So screening is a big component, and then also, risk reduction surgeries, which you spoke a little bit about. But prophylactic mastectomy is an option. It's not necessary. That's a personal choice. Same with prophylactic salpingo-oophorectomy, which means taking out your uterus, fallopian tubes, and ovaries. That's also an option. I just want to make sure I'm reading this right, but they recommend having, if you're going to do bilateral, I'm going to call it TAHBSO, so I don't have to keep saying that. But they recommend after completing childbearing, ideally BRCA1 by ages 35 to 40, and BRCA2 ideally by ages 40 to 45. Those are the NCCN guidelines.
When we talk about screening, a lot of these screenings cause anxiety, and maybe like from your standpoint, you could maybe express like into these women, like when you're told, every 6 months you have to have a scan. Like I will never forget from the age I was 18 years old until the time I was 32, except for when I was childbearing, I constantly had to go for scans, and it caused so much skin anxiety for me, and I know for so many women, everybody's needed a term. Maybe from your standpoint, you could touch base a little bit on like skin anxiety and how we can help a little bit with these women to reduce it. Obviously, anytime you're going in for a scan, that you're looking to find if there's cancer in your body, it's not easy, right? But maybe like a different approach from your side, like as an insider, you can share with the community.
I don't scan anxiety or scanxiety, I've heard it called. I think it's a real big. It's really tough. I can't even imagine having to go through these scans every 6 months and then other medical procedures. So I don't think there's really any key to overcoming the anxiety. Just know that, the point is to find cancers early. So even if we found an abnormality, the hope is that if you're keeping up with screening, that we find it early, and not everything we biopsy or find is cancer. So that's also something to keep in mind. We typically quote the number about 80% of biopsies we do are not cancer. The numbers is definitely less for BRCA carriers because of the increased risk for breast cancer. But, the whole point is to find things early. So hopefully we're finding them small. Screening's not perfect, but when you combine mammography and MRI, the chance of this being, a cancer that may kill you becomes lower and lower. Most breast cancers now these days, thankfully, are treatable. And so that's really just try to keep it in perspective that, if you're getting it every 6 months, it's not that much time that's going by, hopefully. COVID threw everything off, but get back on your screening regimens and try to find those cancers early.
You said COVID, right?
Yeah.
Like breast cancer doesn't quarantine, we say, right?
No.
Like maybe you want to touch a little bit basis, from your perspective again of, like women are getting caught at later stages. Screenings are being put off. Maybe from your perspective, you could explain a little bit like why we need to continue our screenings and not put them off. A lot of women we say are places now are cleaner than they ever were.
Oh yeah, I mean it's very safe to get a mammogram now at this point. Starting in March of last year and maybe till May, we stopped putting off screening mammograms and we were just doing diagnostic studies or biopsies of very suspicious things. But now we're fully back to normal. So get your mammogram if you're overdue. Like you said, we're seeing an increased number of late stage breast cancers, and it's presumably because of people putting off screening exams that they probably needed during the pandemic. But we mask, we sanitize, we do all the things that we need to do. We're doing temperature screenings that I know most places are. And, I'm vaccinated. Many people are vaccinated these days. Hopefully, I know it's a little bit harder in Florida, but in New Jersey, it's ramped up very well. So, get that vaccine when it comes to you. One thing we do talk about, though, is that the COVID vaccine actually can cause lymphadenopathy. So if you can avoid it, try to get your mammogram before you go for any COVID vaccinations. If it doesn't delay care, don't delay your mammogram because of a COVID vaccine. But if you can, try to schedule it about 4 to 6 weeks after your second dose. But again, as long as you just tell us you had your COVID vaccine and what side you had it on, most of the time you could figure it out without having to do anything else regarding the lymphadenopathy.
Because there's a lot of literature out there
Yeah.
about having your vaccine and getting a mammogram that basically you should hold off on getting it, correct? Because it
Yeah.
is showing
It's
lymph
not even
nodes
a lot of
swollen.
literature. It's just a lot of actually, it's like hearsay because, it's all so new. And we started hearing about it. We started talking about it on Facebook groups of radiologists kind of saying, I'm seeing this, I'm seeing this. So it's, the literature follows. But like, yeah, we've seen a lot of lymphadenopathy initially on the side that you get your COVID vaccine because of your body's reaction to just getting vaccine. It means it's working. So,
Right.
yeah, it's an important topic. But don't delay. Get your mammogram. Don't delay any further. Yeah.
Exactly. You know, the other thing that I'd love to touch base on is like, where can women find you, right? And
Mm-hmm.
as we're going to continue to do programs and
Yeah.
educate, make sure that you follow the Boobie Docs on Instagram. Do you guys have a YouTube and a TikTok or?
We don't have a YouTube, but we have everything else. We have Facebook,
Okay.
so it's at the BoobieDocs, BOOBIE, the BoobieDocs across all platforms except YouTube. But yeah, we pretty much do most things on Instagram. You could always DM us if you have a specific question. We try not to answer specific medical questions on Instagram. It gets a little
Right.
tricky, but we will always point you in the right direction. And we always say we give the breast info. We're trying to really provide what the guidelines say. If we don't know, we're going to ask an expert. Next week someone recently asked me, I have terrible lymphedema.
Mhm.
What resources are there? So, we're constantly changing and, we're trying to talk about what people want to talk about. So if there's ever a question you want us to research or post about, certainly message us. And we would love to work more with your program, your organization. So
Thank you. We definitely will continue. And, as you talk about lymphedema,
mm-hmm,
we do have a program, just so both of you ladies know, that it's called Bras for Brave Beauties,
mm-hmm,
that we fund women post-mastectomy bras and lymphedema sleeves as well as prosthetics. So if there's anything we can ever help with, I know lymphedema is not something we speak about a lot,
mm-hmm.
and we have some calls coming up. We actually have Dr. Garza from PRMA, Plastic Surgery in Texas, coming on
Mm-hmm.
April 12th to talk more about it because it's not spoken about enough. Women don't understand it. Women don't know what it is. And then they don't even know these garments exist or they're way too expensive and women just can't afford them.
That's amazing.
If we can avoid that barrier and just help those women feel comfortable and obviously take down the swelling and all the pain that they're in.
Mm-hmm. Amazing. One thing you had asked me in text that I just want to touch on, you said, if I have a child, when should I consider, I'm BRCA positive, when should I consider getting my child tested? And that's a really complicated but important question. There's no right answer. It really depends on personal preference because there's a lot of implications that come with it. So I reached out to my friend who's a genetic counselor and she said they don't test minors because it doesn't change management. There's no need to worry about it yet. And also you don't want to take away your child's autonomy, their willingness. They get to choose if they're tested or not. But you would start to have the conversation or, start the conversation probably early on, but you might consider getting your child genetic testing when they're adults in their early 20s, because you would want to start breast cancer screening, at age 25 with MRIs. And a little, possibly a little bit later for male children. And there's also reproductive implications. So certainly before they have children of their own, they would want to get tested. But it's not an easy decision. There's a lot of psychological components of it as well. And then the implications beyond their other first degree relatives. So.
It's interesting. The conversation and question always gets asked on.
Mm-hmm.
And, I personally say that I don't have interest in testing either one of my children. We're both at 50% until they're over 21. My daughter and son are very well aware of what the BRCA gene mutation is. They're well aware, unfortunately, of what cancer is due to our family and our diagnosis is. And, we're very open. I don't hide it. BRCA strong exists because of my daughter. Like, I am who I am because she's given me the strength to continue. And, for me, it's like when women ask me, I don't, again, have any interest in testing my child right now, either of them. And I know the BRCA gene and all these other mutations that are being found, POP2, ATR2, ATM, within time, I think there'll be a vaccine or a nose, a nasal spray or something. I'd imagine is, I mean, 10 years ago when I was, 18 years ago when I was diagnosed to when I had surgery 6 years ago. I mean, we weren't offered embryo testing. We weren't offered any of this. It was here, go forward. There's nothing to do.
Mm-hmm.
Now all these options are coming. So I just put it down the pipeline. Obviously, there's something that can help our children, and
Yeah.
as well as I'm sure many other women do, and even women who aren't genetic or those genetic mutations aren't identified yet. And
Right.
I'm sure as you can relate, there's always new literature coming out. The guidelines always change for screening. The guidelines are always changing for
Yeah.
something. So I'd imagine there's something coming down the pipeline.
For sure. And also find yourself a good genetic counselor. Like, they're really a good resource. A lot of times primary care physicians and OBGYNs, this is not their specialty. Like, they're overwhelmed. So really find a genetic counselor who's in your, always in your best interest, and can ask these complicated questions too, and what the implications are for you and your first degree relatives. So.
Remember when you do genetic testing, if you do it through an office or you do it through online, like Invitae or Myriad or Color, these companies all have genetic counselors. Like, I never realized what a genetic counselor was until I had to face this. And now, like, when I seriously know what a genetic counselor does, I'm like, every patient should have one.
Oh, yeah.
Because it really does make a difference. They guide you. You're not on your own, because it's not just, again, about the breast or ovarian or uterine or cervical and endometrial cancers, right? It's about your whole body.
Right.
So it's like they guide you and tell you where to go. So that's such an imperative piece. And I feel like, we have a medical panel coming up in May, and I look forward to it because it's a breast radiologist, it's a breast surgeon, it's a plastic surgeon, it's it's the whole panel, because it's not just, let's see a plastic surgeon or a breast surgeon or an ovarian, it's skin cancer, it's every other thing that goes with it.
Right.
So, we definitely look forward to having like an true educational time with you guys, either on IG Live or on Zoom. And I really appreciate you taking the time to reach out and share our story on BRCA Strong, and any way we can help anybody in your community or anybody that's listening today. Just make sure you send us a DM. You can email us. You can go on our website. You can apply for our pre-mastectomy care packages and bras for great beauties right online. And we want to make sure that you ladies feel whole again. And going through this process is not easy. And we want to eliminate that barrier. Know that you're not alone. When you go home, you have something to wear. You have something that you're comfortable in. We all know drains are like the worst thing ever. Mm-hmm. So anything that we can do to eliminate those and help women, that's our goal. And as we keep growing for 2021, we're excited to partner with many physicians like you.
Awesome. Thank you so much for talking with us today.
You're welcome.
We reached out to each other. So
definitely.
And follow us at the BoobieDocs and BRCA Strong.
Perfect. I hope you have a great time. Enjoy your weekend.
Thank you so much. You take care.
Bye-bye.
Bye.
Bye-bye.